A 24-year-old woman is pregnant with her first baby during her 7th month. She complains of backache. The nurse teaches her to Option A. Sleep on a soft mattress. Option B. Walk barefoot at least once a day. Option C. Perform Kegel exercise once a day. Option D. Wear low-heeled shoes. The answer is Option D. Wear low-heeled shoes. A frequent cause of backache in the third trimester of pregnancy is the combined effect of relaxation of sacroiliac joints and the changes in the center of gravity of pregnant women due to enlarging uterus. Wearing low-heeled shoes, especially when on her feet for extended periods of time, will help to minimize this discomfort. A patient is hospitalized for the treatment of severe preeclampsia. Which of the following represent an unusual finding for this condition? Option A. Convulsions. Option B. Blood pressure 160 by 100. Option C. Proteinuria. Option D. Generalized edema. The answer is Option A. Convulsion. Convulsions are associated with an eclamptic condition. The other findings are usual for severe preeclampsia. A patient is placed on an external fetal monitor. The nurse notices that the fetal heart rate is erratic during contractions but returns to baseline at the end of each contraction. This should be recorded as Option A. Early decelerations. Option B. Variable decelerations. Option C. Late decelerations. Option D. Fetal distress. The answer is Option B. Variable decelerations. Variable decelerations are frequently caused by transient fetal pressure on the cord and are not a sign of fetal distress. A change in the mother's position will usually relieve the problem. Early deceleration is normal. It is characterized by a drop in fetal heart rate early in the contraction, typically due to heart compression. Late deceleration is characterized by a drop in fetal heart rate late in contraction. This is indicative of placental insufficiency. The client should be turned on her left side and prepared for possible cesarean section. A woman is admitted with a severe preeclampsia. What type of the room should the nurse select for this woman? Option A room next to the elevator. Option B, the room farthest from the nursing station. Option C, the quietest room on the floor. Option D, the labor suite. The answer is Option C, the quietest room on the floor. A quiet room in which stimuli are minimized and controlled is essential to the nursing care of the severely preeclamptic client because she will need continuous monitoring. The room farthest from the nursing station is inappropriate. Additionally, this client may not need to be in the labor suite. The first goal of care is to prevent the condition from worsening. A glycosylated hemoglobin level is ordered for a pregnant diabetic because it Option A is the most accurate method of determining present insulin levels. Option B will predict how well the pancreas can respond to the stress of pregnancy. Option C indicate mean glucose level over a 1 to 3 month period. Option D give diagnostic information related to peripheral effect of diabetes. The answer is Option C indicates mean glucose level over a 1 to 3 month period. Glycosylated hemoglobin measurements can be used to assess prior glycemic control. They have no predictive capacity. They provide a more accurate clinical picture of diabetic control, but not its complication. They are not used for current blood glucose levels. On the second day postpartum, the nurse asked the new mother to describe her vaginal bleeding. The nurse should expect her to say that it is Option A red and moderate. Option B red with clots. Option C scant and brown. Option D thin and white. The answer is Option A red and moderate. Lochia rubra is moderate red discharge present for the first 2 to 3 days postpartum. Multiple clots are a sign of lack of tone in the uterine musculature. Scanned brown discharge, lochia serosa would be present 7 to 10 days after delivery. Thin white discharge, lochia alba begins around the 10th day and ends about 3 weeks following delivery.